So the role of pharmacy is changing to meet the demands of the NHS and to meet the needs of the public that we serve. So essentially what comes with that is the need to upskill and develop the workforce to be able to meet those demands. One good example would be Pharmacy First within a community setting and the challenges that is clearly bringing, as well as the benefits. So essentially that's how pharmacy is changing across the sector. So pharmacy technicians work across many different parts of pharmacy. So you will find a pharmacy technician working in your high street pharmacy, within a hospital setting, in your GP surgery, within the prison service, within primary care. The role of the pharmacy technician is essentially to support the pharmacist. There are very different roles that the pharmacist carries out as opposed to the technician, but over time that's evolved. Primarily, pharmacy technician has contact with the patients, whether that's over the counter, in a community setting, in a hospital, within the pharmacy, or indeed at ward level. They will carry out medicines reconciliation and they can counsel patients. The primary role is to dispense safely and effectively. The role has developed over time to pick up some of the traditional roles of the pharmacist. So for example, accuracy checking, the final accuracy checking of a prescription. Patient group directive is something that has just been announced, which we're looking at with an open mind. Also medicines administration, so you can train your pharmacy technician to administer medicine within certain medicines, not every medicine. And they also provide leadership qualities, supervision of staff. Essentially, you can train your pharmacy technician to pick up any role to support your pharmacy.
Well, I think the Combined Authority are really keen to support the pharmacy sector. Obviously we've got the Skills Bootcamp funding, which is a great opportunity for people to go on some technical training, get a feel for the sector and hopefully progress into some quality work. I think that we know that across the wider health and social care workforce there are plenty of challenges. We've got an ageing population, people are living longer with multiple health conditions, and we've done quite a lot of work in this area already. This Skills Bootcamp I think is the first time that we've done it specifically within the pharmacy sector, but we're really keen to make it work. I think that we know that likewise within this sector people are facing challenges. It can be long working days, can have lots of different people coming into the pharmacy. I know unfortunately they're subject to abuse in the past and all sorts of challenging conditions. Sometimes the pay is not great, but I think we do know it's a rewarding career as well. It's an opportunity to make a difference to people's lives. It's an opportunity to make a real positive impact on the community. So over at the Combined Authority, I think we're well aware of the importance and the difference that things like pharmacy technicians can make to the community and to the impact they can make on people's lives. So things like this boot camp, which I think can maybe attract more people into the sector and give them the skills to succeed and to work, are really, really important. So we're dead keen, I think, to work with Woodspeen Training and to make this a success, to get people more aware of the sector, more aware of the opportunities, perhaps the chances to progress into the career, the chance to develop skills, and skill boot camps I think are a really great way of achieving this.
So the Skills Bootcamp in Pharmacy is a funded, employer-led initiative for individuals to gain some of the skills and knowledge that they need to confidently move into a pre-registration trainee pharmacy technician role. They can either work in the community, in the retail pharmacy sector, or indeed within NHS. Okay, so Woodspeen Training will work with the employer to advertise the vacancy, attract individuals, screen and shortlist applicants on their behalf, and then train them through the 10-week Skills Bootcamp in Pharmacy in preparation for an interview with the employer.
The reason you should apply is it's going to give you an opportunity to gain potential work experience, a guaranteed interview, and potentially move you on into a role within the pharmacy. It's giving you industry training, it's giving you knowledge, understanding, and the eligibility criteria is you have to be 19 plus, you have to live in the Manchester area, you also have to have lived in the UK for 3 years plus, and you have to have maths and English A to C, or you have to have functional skills level 2 in maths and English, and a science would be really good.